Hi guys. In this video we're going to talk about an approach to tachyarrhythmias. Tachyarrhythmias are some of the most common things that are encountered in the inpatient setting, and in all specialties people have to become familiar with at least the basics of managing tachyarrhythmias. So what I'm going to show you guys is a framework that I have found useful that is somewhat based in the concepts of electrophysiology that I think is a helpful way to think about what tachyarrhythmias are and how to go about managing them. Most of the algorithms that people have come up with online will rely on sort of sorting tachyarrhythmias into narrow and wide and regular and irregular, and this is a slight variation on that I think is a little bit more mechanistically useful. So first, the question to ask yourself when you're presented with a tachyarrhythmia is whether the patient has a narrow QRS or a wide QRS. And I think it's really worth spending a little bit of time to understand what these things mean. So a narrow QRS basically is an indicator that the patient is using the His-Purkinje system in the normal way. That's really the only way to get a narrow QRS complex for the most part. On the other hand, a wide QRS complex means something else is happening, anything else. And that could be a variety of different things. One way that you could have a wide QRS complex is not using the normal His-Purkinje system. So ventricular tachycardia is an example of that, where the arrhythmia originates in the ventricle, so you're just not using the His-Purkinje system. Another way to have a wide QRS is if the His-Purkinje system itself is not working properly, meaning you're still using the His-Purkinje system, but there's a bundle branch block or some other sort of conduction delay that prevents the His-Purkinje system from conducting quickly and normally. Another possibility is that there's some other connection that exists between the atria and the ventricles, and that would be a bypass tract, for example, Wolff-Parkinson-White. And the last common possibility that's seen for a wide QRS is you're not using the His-Purkinje system because you have an electrical device that's delivering the pacing to the ventricle, or a pacemaker. So that's sort of what differentiates narrow QRS from wide QRS. The other characteristic of an arrhythmia that I think is useful to understand is the underlying mechanism of the arrhythmia, and the two most common ones that I think are worth understanding are having a single ectopic focus, or I guess I should say a single automatic focus. You don't necessarily need to be ectopic, or having a re-entrant circuit. An automatic focus is when there's a single place in the heart that is firing at a certain rate. Sometimes that's normal, like in the case of the sinus node, or sometimes that can be in a different location in the atria or in the ventricles. Whereas a re-entrant circuit is a specific anatomical area of tissue where there is an electrical circuit that gets established. It can be a small circuit entirely in the ventricular myocardium. It can be in the AV node. It can extend down a bypass tract. There's a lot of different re-entrant circuits that are possible. Thinking about every arrhythmia then, every tachyarrhythmia, we can sort of understand it as falling somewhere in this categorization of either narrow or wide, and either coming from an automatic focus or a re-entrant circuit. So starting in this quadrant up here, tachyarrhythmias that are coming from an automatic focus or an ectopic focus with a narrow QRS. The most basic example of this is sinus tachycardia. The sinus node is an automatic focus, and QRS is narrow because you're using the His-Purkinje system in the normal way. However, you can also get atrial tachycardias that show up here. Some people will call these ectopic atrial tachycardias. Junctional tachycardias can also show up here, where the automatic focus is within the AV node itself or within the AV junction. So sinus tachycardia, the focus is in the AV node. In the sinus node. Atrial tachycardia, the focus is in the atrial tissue. Junctional tachycardia, the focus is in the AV junction. If the focus is in the ventricle, then that results in ventricular tachycardia, which of course has a wide QRS. And these are sort of the most common automatic focus rhythms. Now, when it comes to reentrant circuits, there's a variety that you can see. Now, in order for it to produce a narrow QRS on the ECG, a reentrant circuit arrhythmia has to have the reentrant circuit still using the His-Purkinje system in the normal way. So one way for that to happen is for the circuit to be entirely within the atrium. So that would be atrial flutter, or sometimes people will describe a macro reentrant atrial tachycardia, where there's not just a single focus in the atrium, but a little circuit inside the atrium. Another way is for the entire reentrant circuit to be within the AV node, and that is AVNRT, or AV nodal reentrant tachycardia. If the reentrant circuit is entirely within the ventricle, then that usually causes ventricular tachycardia. It's a wide QRS complex because you're not using the His-Purkinje system in the normal way. The other reentrant circuit that's worth going into a little more detail here is AVRT, or atrioventricular reentrant tachycardia, when you have a bypass tract. In that case, one limb of the circuit uses the His-Purkinje system and the other limb of the circuit uses the bypass tract. If you use the His-Purkinje system going down, meaning if you use the His-Purkinje system in the normal way, then you can still get a narrow QRS complex. And so that is called orthodromic AVRT. On the other hand, if you use the bypass tract going down and the His-Purkinje system going up, then that will result in a wide QRS, and the name for that is an antidromic AVRT. So these are the basic rhythms that you may see, and whether or not they have narrow or wide QRS. Now, there's one sort of glaring hole in what we've done here, which is the idea of aberrant conduction. Essentially what that means is any one of these tachyarrhythmias that normally are associated with a narrow QRS, if there is a problem with the His-Purkinje system or some other connection between the atria and the ventricles, any one of these can be associated with a wide QRS instead. So all of these could potentially exist in the wide QRS side if you have aberrant conduction between the atria and the ventricles. Most often that's with a bundle branch block. Similarly, any one of these reentrant circuits that are normally associated with a narrow QRS, if there's aberrant conduction, could end up having a wide QRS. One final point to make here is that there are two arrhythmias that you should know about that don't fit cleanly into this categorization. And those are situations not of a single automatic focus or not of a clearly defined reentrant circuit, but of something else altogether, which for the lack of precision terms, I'm going to go ahead and call chaos. Again, I know that's a little bit imprecise, but essentially what this means is that there's some complex electrical activity happening that has multiple wave fronts, maybe multiple reentrant circuits that are shifting around in space and in time. The reason why it's important to know that is that this is often the mechanism for atrial fibrillation, which, since it's all in the atria, usually has a narrow QRS. Again, if aberrant conduction is present, then this can be a wide QRS rhythm. And finally, the other rhythm you should definitely know about that fits this bill of chaos is ventricular fibrillation. Obviously, that has a wide QRS and is chaos for many different reasons. To summarize, one useful approach to tachyarrhythmias is to think about them as falling into one of these buckets based on whether they have a narrow QRS, meaning using the His-Purkinje system in the normal way, or a wide QRS, which means any other thing than using the His-Purkinje system in a normal way. And so some examples of that are not using it at all, it's not working properly, there's another connection, or there's an electrical device. The other way to understand the tachyarrhythmias is whether they're caused by an automatic focus or a reentrant circuit, and then this little side note of electrical chaos. This can help you separate our tachyarrhythmias into buckets, can also help you remember what aberrant conduction will do to each of them. This is a useful classification because it can help you better understand how to treat patients that have these arrhythmias. For example, if a arrhythmia is caused by a reentrant circuit, in general, the treatment will involve abolishing that reentrant circuit. Thanks, guys. Hope this helps. Feel free to leave any feedback in the comments and click subscribe to see new videos as I post them.